Hey, everybody, it's Dr. Steve, and here we are for Everything is Connected, and this is part two of our nerves, move it, groove it, and mobilize it kind of dance. So, in part one, we talked about the radial nerve. Today, what we're going to do is we're going to go into the median nerve, and we're going to follow the same kind of format. We're going to do a direct mobilization and then a little more indirect mobilization. The median nerve comes down the kind of the inner part of the arm and down the front of the forearm into the hand. This is the nerve that's talked about as the culprit for carpal tunnel syndrome. And so carpal tunnel syndrome is where you get numbness and weakness and some tingling into the hand. Very often it can be something that wakes you up at night and it can be really uncomfortable. And there's a very common surgery that they do where they go in and they try and release that nerve from restrictions in the wrist. Well, the interesting thing is that there's lots of different places that nerve can get hung up, not just the wrist. And so one of the things that we want to do is we want to mobilize that whole nerve pathway. So that's what we're going to do. So to do the little median nerve dance, what we're going to do is first have the arm by your side, and you want to sort of depress the shoulder or sort of push the shoulder down towards the ground. And then from there, we're going to bend the wrist back so that the palm is pointed towards the floor. And then we're going to rotate the hand out a little bit. And so here we're going to start to lift up. Now, you can get a strong, deep stretch kind of sensation through the forearm and the elbow. That's normal. You don't want to make it miserable, but that's what you're stretching. You're stretching nerves and the nerve tissue all through there. And so that's something that you're on the right track if you get a deep stretch through there, but you don't want to go so far, so high that it just feels like, oh, okay, that's miserable, that's tugging. You want to bring it down a little bit, and we're still trying to keep the shoulder pressed down, but you want to bring the arm down to a comfortable level. And then in this position, we're going to get the little dance going. So here we're creating a lot of tension by bending the wrist back. We're putting the nerve on tension here. So we're going to tip our head away to open up that space where the nerves are exiting and give it a little more breathing room. And then we're going to do the head and wrist dance. So we're going to go back and forth when the wrist bends back and the palm tips away. We're tipping our head away from that side. So we're opening up the foramina where the neck, in the neck where the nerves are exiting. And we're doing this little dance back and forth. So then with the wrist bent back, we're going to have the head tip forward, and then we're going to do an up and down with the head. So as the wrist tips back, we're flexing the neck and we're looking down. As the wrist comes up, we bring the head up. And then we're going to add the rotation. So here as the wrist is bent back and we have the nerve on tension, we're going to look away, and then we're going to bring the head back to center as the wrist comes back to center. So here, this is what we call a direct mobilization. We're getting the neck moving to change the orientation of the space where the nerves are exiting, and we're getting the nerve moving back and forth as we're asking the wrist to do some motions. So that's a very direct mobilization for that median nerve. Now we're going to go into an indirect one and do a little different dance with the nerve. So for this one, we'll use the other hand, but we're going to do that same kind of position. First, kind of pressing the shoulder down, and then we're going to bend the wrist back, turning the hand out, and then we're going to lift that hand up, but we're going to put it onto the wall, and I'll try and do this so that you can sort of see here. But then what we're going to do is we're going to have the 1 foot forward and keeping the wrist on the wall like that. Now we're going to get the hips going and do the little hip dance that we do in the 3 directions. We do some forward and back here. We're going to do the side to side, kind of tipping the hips into the wall and away, into the wall and away. And then we're going to do some rotating. The whole body, everything gets to turn around the corners as we go here. And this is an indirect mobilization for that median nerve because we put it onto a stretch position. We put some tension on the nerve, and then we got the rest of the spine moving in all of the different directions. And so we're creating a mobilization through the spine, through the nervous system. As we put that nerve into a stretch position, we're wiggling and jiggling all the parts that are connected because, as we know, everything is connected. And so that's creating a mobilization for the nerves. So if you or anybody you know struggles with some carpal tunnel, before you get talked right into a surgery, come see us and see if we can help by mobilizing the nerve. And as I said, there's numerous parts that it can get hung up. And sometimes just focusing on the wrist and only doing something there isn't going to solve the problem. Because if the nerve is hung up more at the elbow or up in the armpit or in the brachial plexus or even exiting the neck, doing a surgery for the wrist isn't going to fix those other nerve entrapment sites. And so, although carpal tunnel surgery sometimes is very successful and helpful, for many people, unfortunately, it's not because it's not addressing the underlying cause. Because as we know, everything is connected. And if we're only looking at an isolated spot, we're missing all of the other connections. So let's keep moving forward. We're going to do part 3. We'll be looking at more of the ulnar nerve, which is the funny bone nerve. But here we've got the median nerve. We got a little dance going with some direct and some indirect mobilization. So keep moving, everybody, and I'll see you next time. Bye-bye.